Hello and welcome to We Work Together, a podcast about people working in partnership to improve health and care across West Yorkshire. In this series, we're showcasing the West Yorkshire Staff Mental Health and Wellbeing Hub and hearing from people across the West Yorkshire Health and Care Partnership. In this episode, Kerry Hinsby is joined by community pharmacist Ashley Cohen, GP practice manager Alex Avis, and GP Katherine Hickman to discuss how the well-being of those working in primary care and GP practices has been impacted by the coronavirus pandemic.
So we're here today for this podcast to talk about really the impact of COVID, but particularly on primary care and GP practices. So I'm Kerry Hinsby, I'm clinical lead in the Staff Mental Health and Wellbeing Hub, and I'm joined by Ashley Cohen, who is a community pharmacist.
Hi, Kerry.
Alex Avis, who's a GP practice manager.
Hi, thank you for having me.
And also Katherine Hickman, who is a GP over in Bradford.
Hi there, lovely to be here.
So I'm curious really about what brought you here today.
I've always had an interest in people and how people work and how people operate. And running your own business and looking after upwards of 100 staff we've had at some point. I've always had an interest in individuals' well-being. And I've noticed over the course of the last 18 months, quite a lot changing in people's behaviours, people's attitudes within work, and loads of different phases that went through the staff. As a business owner, I feel I've got a responsibility to them in terms of looking after them professionally, financially, but also personally. And I've had to play that father figure over the course of this year. And it's a role that's taken a lot of my time and exhausted me as well. So I'm here because we're all human. We've all, I suppose, been 1 hour away from being completely unable to manage your own reality.
Thanks, Ashley. Katherine, can I just bring you in there?
I'm probably here today really because I did go through an episode of burnout a few years ago. And I suppose it makes me acutely conscious of how I would have reacted, say 7 years ago, if that pandemic had happened. And I think in order to deal with something of such magnitude, you have to be in a really stable position of very much aware of your mental and your physical health to be able to not only deal with yourself, but also, as Ashley said, to deal with staff. And at the time, 7 years ago, I left a partnership because of burnout, became a locum and salaried doctor. But within that, during the pandemic, I actually became a partner again. So again, that had that added responsibility that I had to look out for. I think the pandemic has also forced us to have maybe some uncomfortable conversations about our own well-being and how we can support each other, both in this kind of acute reactive phase, but also how can we be more proactive going forward and looking after ourselves, and to normalize these conversations that were definitely not happening for me 7 years ago, but they feel that like they've been almost escalated much quicker because of the pandemic, which is a bit of a silver lining.
Alex?
I'm still on a phased return to work. The last 20 months have been really difficult and, without realizing, have taken a toll on me and potentially my mental health. As a practice manager, you tend to want to protect your staff, up to a point as well, the patients, to ensure that you remain open and continue to provide a service out to the community. It's been non-stop, and up to a point, I might have had most of my staff working remotely from home. For the vast majority of the time, I was a constant in and out of the practice. So I might have had all my staff working a minimum 1 day a week. I ended up working 5 days a week. So throughout this pandemic, thinking that as a practice manager, we are superhuman, I protected my staff, but neglected to think about myself. And in hindsight and looking back, I've realized that I have been struggling with my own mental health. And it came to a head about a month ago, where I ended up having to take a bit of time off work. I'm very lucky in so much as I've built myself a very strong management structure, because I came to the conclusion that knowledge isn't power. The power is by empowering your staff around you to be able to maintain some form of working relationship. So when one person goes down, the whole system doesn't fall over. We're all human. We need to look after ourselves. But sometimes we need somebody, and I'm very, very lucky to have someone like Dr. Hickman, who can come in and look at me and say, yes, okay. And maybe remind me that I might not be fine and okay and smiling. And also to understand that it takes courage, more so. It takes courage to realize that one is struggling and to seek help. It's not a sign of weakness. It is, on the contrary, it's a sign of courage that, one does understand that one needs help.
That's fantastic, Alex. Thank you for sharing. And there's so much to pick up on there. And hopefully we'll give credit to all the points that you've raised. I guess what I'm really picking up on is that sense of looking after yourself, knowing your own limits, but also this increased spotlight and increased responsibility, or felt sense of responsibility to look after others. And I think whilst the pandemic, absolutely, I'm so pleased that the spotlight's been shined on staff wellbeing. We weren't perfect beforehand, but the systems weren't in place beforehand. And COVID has given us this chance to really start bringing in some of those resources and some of those systems and some of those conversations like this. What we're seeing, though, from the Staff Mental Health and Wellbeing Hub is that people are still reluctant to come forward. I think there's something about us being carers that becoming cared for ourselves is an extra barrier that is hard enough for members of the public to face. But if you're somehow in that caring role with everything that brings, how you overcome that for yourself and support your colleagues to overcome those extra barriers. So I'm just wondering, to come back to you, Ashley, what you're hearing, but maybe particularly during those phases and the different phases, what you noticed in yourself and your staff in terms of particularly, I guess, seeking support.
Very rarely pre-pandemic would I have had a conversation with my peers, friends, I'm not just talking about work colleagues, I would have checked in and asked, how are you really feeling? Right? We would have brushed over that, or it would have been this kind of male bravado. And it's very much, I noticed with some of my male colleagues and friends, it's very much brushed under the carpet. I have a lot of male friends that I now open those conversations with, actually delving deep and asking really how they really are. And I think there will be some positive things that will come out of this, because I'm finding across my peers, across my network, my pharmacists, is that it's being raised a lot higher. So number one, I'm definitely seeing that it's less of a stigma than it was to say, I'm not okay. And I've used that on a number of occasions. I've had to say, I'm not good at the moment. It was previously probably seen as a sign of a weakness. It's not actually now. And I think that's been really useful. For me, the phases was quite interesting, because some of our staff at the very, very beginning of the pandemic felt very glad that they were in a professional role that meant that they had a job to go to. So I've got a range of people that were seeing other friends and colleagues that I had that lost their jobs overnight. So the pandemic for them had an impact on them financially, socially. And the first few months, there was relief that all of my staff, although that they were working extremely hard, they were relieved that they had a job. And it was at this time that they felt, thank God they were working in an industry that was pandemic proof. Unfortunately, I think what's happened, and I think the NHS has been quite good at this, is we're now 18 months down the line and there's been no relief. And I think what they're finding is now, actually, I don't want to be in this job anymore. I'm not getting the reward and recognition that I was getting for. The clap for carers, clap for NHS is gone. Income and financially, it's been quite difficult for our sectors. We weren't prepared. Before the pandemic, we had a 20% pay cut. And then the government negotiated a 5-year 0% increase. So staff are now at the stage where maybe I would be better off working in Aldi or stocking shelves or whatever. Do I need that? So I'm now having staff that are saying, I don't need the stress. I don't need the difficult time, the safety issues that we're having to deal with. And juggling that and trying to keep people motivated in a very difficult environment and not being able to see the light at the end of the tunnel because this whole storm's always there. So I'm trying as a business owner to keep people motivated personally, giving them the right time off. And I'm finding that difficult because I'm also dealing with exactly the same. So I'm certainly seeing a couple of stages for myself at the moment. And it's difficult for me to be able to offer any hope as to what's it going to look like post-pandemic, because everything that we read is, well, we're now set for another X number of years of difficulty backdated.
Thanks. Just bring Katherine again on the different phases. You mentioned that kind of acuity and almost the pride of being part of this Clap for Carers movement. And I'm aware now, Katherine, it feels like there's a full immediate turnaround, particularly GPs with the face-to-face appointments, and then also how you're supporting staff through those different elements has actually started to pick up on there.
I mean, you're right. There's just been this huge shift. And I think so. So one of the phases, I think there was that acute phase initially. I think everyone was quite confused and worried and scared. But our practice manager, he really did set that precedent of organisation, collaboration, coming together, supporting each other. And it suddenly felt that everyone just came together, and it really felt like a unit, and everyone working together, and it felt like a well-oiled machine, and everything was just running really smoothly. Patients were on board as well. So when I say team, I'm talking about patients as well. They knew that if there was something that they could manage themselves or go to the pharmacist or self-care, they wouldn't phone us. Obviously, we shifted telephone triage and remote consultations and seeing the urgents face-to-face again. So the telephones, everything felt very relevant, very, the people I was talking to needed to talk to a GP, and those that were getting seen face to face really were the ones that were, needed that urgent care. The proportion of 2-week fast track referrals that I was doing in my face to face patients was so much higher than a normal surgery, because that triage element had really filtered out those that really needed to be seen. So I think that was really important. And obviously things have changed dramatically. Obviously the Clap for Carers went. I think everybody, the whole country was very much behind this united front, but people started to get a bit bored of it, a bit sick of being battered away, if whatever term you want to use. And actually that was then whipped up by certain areas of the press, and the government got on board with that. The Daily Mail sort of saying, we've won our campaign. We're now going to, you can now demand to see your GP face to face. And suddenly the level of abuse that not only our reception staff have had, but also the clinical, and it is, I have to say, it is far worse for the reception staff. They really are on that receiving end of abuse. And there is not a day that goes by that I'm not going to work and there isn't a member of our reception in tears. And as Ashley said, why would they want to stay?
I remember at the very beginning of the pandemic how the population were very obedient. We opened our doors, they would queue, and, gone were the days if anybody had to wait 5 minutes for a prescription, we'd get abuse. But they would wait 20 minutes outside, and they'd be 2 meters apart, and they'd come in all grateful that you're open. And you're right that it's changed pretty quickly. And the population have now gone back to pre-pandemic expectations of now.
On steroids.
Yeah. I want it now. I don't care what you say. The narrative has gone. People now won't come in and wear masks. They won't socially distance. The abuse that we're getting now, it's as if, from their point of view, D-Day and, it's all forgotten about from their point of view. There's no restrictions anymore. When we have to close an hour early because we've got staff safety issues, the issues that we get are, well, I'm going to report you. There's no understanding of, there are individuals back here and we're working very hard, and it's gone.
You both raised some really key points about the often hidden staff that don't often get the headlines. So you talked about the receptionist manning the phones. You talk about the people, the community pharmacists, very much front facing. And I know very much, again, at the Wellbeing Hub, our Wellbeing Hub is for all staff, but we often get the message, but it's not for us. And we're really trying to get that message out that it is for all staff. It is for those drivers, those porters, those receptionists. And what you've both described so vividly there is just the amount of abuse that they get from all angles as part of their day-to-day job. And I think you've also both touched on your role when you feel responsible looking after them, because I think there's that role building that staff support into the day-to-day conversations, as well as signposting people if they get to the point where they need extra support. So yeah, I'm just kind of curious if you've got any stories maybe that stand out around conversations you've had with staff, particularly those kind of less talked about staff, where support has helped, or you have kind of been able to encourage them to seek support where perhaps they might not have done without that conversation.
One thing that I've introduced recently is a staff huddle, and it's a bit unofficial at the moment. I'm doing it on my days in, so I do it on a Tuesday and Thursday, first thing in the morning, and then at the changeover at 1 o'clock. And I really have kept it to 5 minutes. But I've had some lovely feedback from staff just to say that they really appreciate that check-in, and we try and keep it fun, focusing on anything that's gone well, and they'll be like, well, we're still standing. I mean, it can range, but even if it's just little things like celebrating birthdays, or but it is an opportunity to check in with them as a team, but also to raise that awareness that if anybody is struggling, that our doors are open as their boss, and they can come in. And I always say to them about it, sort of emotionally vomit, just come in and just emotionally vomit on me. And then you can hopefully feel a bit better. Even just simple things like staffing levels. So I'll say, okay, right, so we should have 3, we've got 2. So I know that I can't push you today. And I will say, look, we're down a doctor. So equally, please be aware that it's not going to work if you're putting excess demands on us.
You talked right at the beginning about the burnout you've experienced, and Ashley, you've mentioned just a personal impact on you, and how some of the narrative and the culture is changing, where it is beginning to be okay to say I'm not okay, but we're not there yet. I think stories, and particularly stories from people like yourselves, are so empowering to encourage other people to seek help. So I'd really like to take the time to ask each of you the personal impact it's had on you and what's helped you.
So obviously I had that episode of burnout and didn't seek help at all. I spent 2 years putting myself back together, which I think in the long run was a good thing. So when the pandemic hit, I was very conscious of exactly what I needed to do, a bit like a sort of first aid. And I did all the stereotypical things. I started yoga. I was doing some meditation at work. But what I hadn't vouched for was homeschooling. That was like this massive curveball. It gave me real insight into my kids and how different they are. And my middle child just didn't cope with homeschooling at all. So he would not allow me to be away from him. And he was screaming. I was in tears. And I thought, actually, I need to get some help. So I did. I was really struggling, feeling of overwhelm, which I kind of prided myself on the fact that I had everything under control. But as I said, I had everything under control because my kids were at school. And suddenly I was like, oh yeah, but the teacher doesn't do it like this. And I was like, well, I'm not a teacher. I don't know how to do long division like that. Everything else was fine. We had this great team at work. Everyone was pulling together with the patients, a real sense of caring for each other in unity. And well, it wasn't like that at home. I was really struggling with anxiety, and I did speak to my GP, and she was brilliant and supportive. And I recognized immediately that unless I was fully in control of my emotions, I was never, ever going to be able to deal with him. And it wasn't an overnight success, but obviously we had homeschooling for months, and just being able to manage my own anxiety, it massively helped, and has had long-term effects. So I think once that had sorted itself out and I knew how to handle him, and then work was ticking along nicely, it was great. But he was really struggling because he didn't have, friends or that support network. Probably similar to me, I need that social element. But it was the fact that I was doing everything that I knew I had to do, and it still wasn't working. I always talk about sort of like a Jenga block tower, and I was starting to feel a bit unstable. And if somebody pushed me, then it might collapse. Also, I remember talking to Alex about this. We had to start working the red hubs as well. And I was just about to go out for my first session. I ended up with this massive row with my husband. And Alex actually said to me, he's annoyed because he cares. I was like, well, yeah, maybe. But and it was. He was framing it that he didn't want me bringing COVID back into the house and killing us all. And I was like, well, what about me? And of course, it was about he was scared about me catching it, which then made me feel very anxious. I sort of felt okay about going initially, but then when he'd sort of sown this seed in my head that I might die, it was just a melee. But I spoke to my GP. Not in a million years would I have considered speaking to my GP 7 years ago. Not at all. I think it's that recognition. Actually, the GP's there and the GP can help. What am I doing? Why am I not talking to them?
Thank you. I can really relate to the homeschooling element, and I have that sense of feeling overwhelmed, but also that sense of failure, that I was failing at work because I didn't have enough time, and I was failing my kids. Alex, your mental health issues are perhaps more recent, more current, possibly even. What would you feel comfortable sharing with us today and sharing with people that are listening?
I'm a veteran. Spent 28 and a half years in the forces, and in 2013 had a burnout whilst I was still serving, and didn't see the triggers in October of last year. I actually grew my hair, grew a semi-Mohican. And for someone who's been in the forces for a long time and who's always been fairly neat and tight, very short hair, looking back in February to see that I'd grown a Mohican was potentially an indication that something wasn't quite right. One of my partner doctors did actually say, you were wondering why you were growing a Mohican, Alex. And looking back, yeah, that was potentially my trigger. I built up some coping mechanisms back in 2013. They more or less kept me going until I left the forces. And I was lucky enough to be able to reach back onto those coping mechanisms. The issue you have is, specifically in the forces, in the army, you're normally away for 6 months, and your adrenaline can keep you going for 6 months flat out. You normally have a 6-month beat up in training prior to a deployment. So that gives you about a year. By the time I turned around to my partner doctors and said I was struggling, strangely enough, was the latter end of February of this year, which is more or less the year after COVID had started. I felt, and I've been saying to a lot of my former colleagues and friends now, that it feels like I've been on operations for 20 months, flat out. The thing is, you can tend to take leave, what we used to call rest and recuperation, R&R, when you're faced with COVID, with this big unknown, and you're all locked down and you really can't go anywhere for R&R. It was trying to understand that I needed to find other ways to literally decompress, because that's what you've got to try to do. You've got to try and hit that reset and charge those batteries so you can then, continue. I was very lucky. I've got some fantastic partners who understood that I needed a bit of time to do that decompression, that reset. And I hope now, coming back to work after having a bit of time off, and I actually had a week where I very directly told them, but they very kindly supported me. I was completely off grid, whereas no one got in touch with me. So that goes to the point, telephone, I didn't look at emails, and I was able to do a really decent reset. I think it's important to have and to create some me time. Everyone's different. I like to immerse myself in music, and I managed to read the book whilst I was off grid. That to me is a huge flag. If I can read, it means I am relaxed. I've not been able to read a book for 20 months. I could not concentrate. And it was all to do around work. It's the fact that you also have a responsibility to your family to try and keep them safe, but also to your colleagues that you work. Now, I forgot to look after me, and I've now started looking after me, and it'll take time. I'm slowly on the road to recovery, but I do look after myself. I try to have a few hours to recharge my batteries.
Thank you. I think that message that you ended on there is so important, that to look after yourself it's not a luxury, it's vital. And that allows you to look after your colleagues alongside you. It's the sort of oxygen mask analogy, isn't it? Again, I think what we hear a lot of is that staff volunteers are reluctant to take time out to look after themselves because somehow they feel they're letting their team down by not being at work. That very sort of physical presence is so important. And I'm also very, very mindful of what you said there, Alex, about the chronicity, the long-term game that we are expecting. People have been struggling through, they have been turning up at work, but people are going to reach their breaking point, and we're going to be seeing the fallout of COVID for a long time to come in terms of mental health. It's not over. And I guess I'm just wondering if you were to give a couple of points of advice to people that are listening that may be on that brink of, gosh, I'm sensing things aren't quite right, I'm thinking about seeking help or just talking to a colleague. What advice would you give to people from your own personal experiences in that position that might just encourage them to take those first steps?
I think it's an easy one for me, and it probably is easy going first as well because I get first dibs at it. But I think talking about it is so important. I've reached out and I have not been frightened to ask those difficult questions to people who I think may be vulnerable. And I think if it's done in the right way, and if you can reach out and you can really delve and just to talk to somebody, it just might provide that support, that they're not on their own. And I just think for people to know that there are others that either are there for them and can support them is the first major step.
I think there's something about taking some time out, a time out for yourself to try and get your feelings out onto a page, or if it's easier to record it or whatever medium feels right. And then it's having the confidence to say, I'm struggling. And going back to Alex, he said, I'm struggling, guys. You said, who's looking after me? And it was like, oh God, yes, sorry. And I hope you feel that we rallied around and supported you, but we weren't proactive. It was a reactive thing, but we took our eye off the ball because we were probably internalizing and thinking about ourselves and not always looking after everybody else. But I hope that you felt that once you'd said it, you felt supported. But I think there must be so many occasions when people say, I'm struggling. Yeah, so are we. We're all struggling, and yeah, move on. But actually, it takes a lot of courage as an individual, but also takes quite a lot of courage as an organization to rally around and truly support an individual member. Because the thing is, you never know when it's going to happen to you. And I know I do talks all the time, and I don't think people can comprehend what state I was in when I was, 7 years ago. And if somebody had said to me 14 years ago, you're going to be like stood in the kitchen sobbing, unable to open a can of beans to feed your kids, unable to talk, I wouldn't have believed them. But actually, it can happen to anybody.
Absolutely. No, absolutely. And I've seen it happen to many, many of my colleagues who themselves would never have thought COVID would have impacted on their mental health. Alex, I'll come to you in terms of quick words of advice that you might give to colleagues out there.
Probably 2 words that I'll put out there. Know your people. Really know your people. All you have to do is look at their faces. Physicalities don't lie. And if you're a good manager, not only can accept the changes that yourself are going through, but you care about your staff, you'll note those individuals who are struggling. So have empathy, have understanding, and change potentially your goals. I say to my staff, do not multitask, one job at a time. Once you finish that, move on to the next one. And if it comes to the end of the day, it will be there tomorrow. Go home, come back tomorrow fresh, and re-hit the day again. One job at a time.
I'm only really beginning to realise right at the beginning people talked about it as a marathon, not a sprint. And I'm only really, I guess, internalizing what marathon means, just sort of thinking forward really, and equally on that systems level and that idea of knowing your people. And we talked about what individual signs might be, but often those signs are just a change and they're all really different for different individuals.
I think one thing it's taught me moving forward is to sometimes appreciate some of the smaller things in life. So I never realised how much I took for granted going out with a family for a meal. But when you lock down and you can't go it because it's been closed and you miss it. So simple things for me to keep us going over the next few months is we're booking little breaks, mini breaks, holidays. And I'm now doing what I've never done before, Alex. I put an out of office in my email. And just for me doing that, it's quite liberating. I also changed my voicemail message to say I'm out and not working. So don't leave a message. And doing those small little things managed to recharge those batteries. So I think looking forward as a family of those spaces where we can properly recharge. We talked about it before about recharging batteries. So those are the kind of small things that I've done, is just enjoy the little things in life a little bit more.
I've really struggled to take me time. It's always about everybody else. But I really have set that precedent at home. I'm going for a walk. No, you can't come. It's me time. I'm going for a swim. It's me time. I'm doing yoga. And they get it. They absolutely get it. Because I think they all have their own time. Why can't I? And with regards to staff, I think that, that awareness of, physicality, but also, how they're talking. And I think for me, doing that huddle on the Tuesday and Thursday allows you to really, you're looking out for micro changes. But actually, if you're checking in on them on a really regular basis, it's much more proactive. You can recognize when things are slipping and you can do something proactively rather than waiting for them to crash.
For me, it's just also in the knowledge that you are not the one and only person with all the fixes. Ensure that you use everybody around you to maybe share a bit of the burden as well. You can never share the responsibility as a manager, but it's to reach out and take the expertise around you to help you achieve your aim without struggling to try and find the easy answers or the right answers. If you use those around you to achieve your aim, you're not as stressed at work.
Thank you so much, Alex, Katherine, Ashley, for joining me today. It's been a really heartwarming conversation, and thank you for your generosity in just being so open and brave and you sharing your experiences. And I really hope, and I do expect that people listening to this will be touched and will be affected, and hopefully will be encouraged to take what you've all described as such an important step to reach out to somebody. It doesn't really matter who it is, but to reach out to somebody so that they are not continuing and struggling on their own. There are always people out there that do want to help, and that there is always a solution. It is just about creating the space, I think, to find what that solution is of what works for you as an individual. So thank you again for your time, and I look forward to having further conversations with you in the future.
You've been listening to We Work Together from the West Yorkshire Health and Care Partnership. For more information on the Staff Mental Health and Wellbeing Hub, please visit workforce.wyhpartnership.co.uk. Join us again next time, when we'll be joined by more people who work together to improve health and care for people in West Yorkshire.